Good morning, colleagues. I just want to welcome you to this webinar on laboratory logistics, on the efficient use of resources in the laboratory. It's one in the series of webinars that is being hosted by the University of Zimbabwe Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology. And in collaboration with the African Federation of Clinical Chemistry and Laboratory Medicine and Empower School of Health, under the auspice of African Consortium on Laboratory System Strengthening. This, as you note, is a collaboration of many like-minded institutions who realize that the challenges that we face in Africa are all similar in terms of laboratory diagnostic capability. And in order to improve how we are performing in the lab, there is what we can do by sharing our knowledge as colleagues in the African continent, sharing our experiences to allow us to learn from each other's experience in order to be able to make the best use of the resource persons we have in Africa, so that we do not reinvent the wheel. What we can learn from others, we learn from others, and freely we must share the information that we have to allow us to learn from one another, because Africa is a small continent. One day I am in another part of Africa. I want to be assured the diagnostic capability that the African country has is similar to any other country, that I will have equal treatment that I would have had if I was in my parent country, so that we make maximum use of the resources, so that we do not doubt the testing that is done in another African country, so that we do not doubt what has been produced, and we know that we are giving the best possible results for the patients that we have. And you note that today's webinar is targeted on laboratory logistics. No matter your lab is a for-profit lab, or it's a charity-based lab, you still need to make the most efficient use of resources for the good of the patients, for the good of the of even the investors who are investing into your processes, and the need for efficient use of resources in the laboratory. And we have with us two speakers who are going to speak on pertinent issues with regards to laboratory logistics, and in particular the efficient use of resources in the laboratory. The first speaker would be speaking on pre-analytical consumable wastages on specimen collection tubes, quality and costs, whereas the second speaker will be speaking on efficient management of laboratory supplies, which are a very important issue in the lab. And after they've spoken, we will have a chance to have a roundtable discussion where you can pose questions or even contributions to what has been shared, so that we can learn from one another, and we can also enable ourselves to have better lab practices in Africa. And during the discussion, you can use the chat box to send in your comments or your contribution And you can also raise your hand after the presentation, the two presentations, so that you can make a contribution, so that you can pose your question. You can also add on to what we have been sharing, so that we learn from one another. And we will be having a certificate of attendance for those who have attended this webinar. You get a link to where you'll be able to indicate your details, and then your certificate of attendance will come based on the time that you were present during this webinar. And also, we are also live streaming on Facebook in case we reach the limit on the Zoom platform, to allow those who would also want to join in from even if we have reached the maximum allowable participants on the Zoom platform. I do not want to take much of your time. I would like to give the presenters as much time as possible to allow us to benefit from them, and also to allow us to have more time on discussions. So the first presenter would be Chaka Ndou, who is the quality coordinator at Tshwane Academic Division, NHLS Base Camp, Tshwane Academic Base Camp, Tshwane Academic Division, University of Pretoria, Pinshof campus in the province of Gauteng, who is going to present on pre-analytical consumables, wastage on specimen collection tubes, quality cost. Over to you, Chaka.
Thanks very much, Dr. Machingura, and thanks to you all attendees or participants. As I've been introduced, my name is Chaka Ndou from Tshwane Academic Division, which we simply say TAD. Tshwane Academic, maybe to give you an overview, is just one of the 7th referral lab in South Africa, which the hospital which we are attached to here is Steve Biko at Tshwane District Division. So meaning our laboratory is quite massive, is one of those big hospitals in South Africa. So from the lab perspective and what I've been requested to look at, I wanted us to look at this presentation in the context, or the subject in the context of saying from the pre-analytic setting, more especially for the labs which are making profit to sustain themselves, even those which are not meant to make profit. However, for sustainability, I don't think we can allow to have wastage. So I thought it's more appropriate for me to look at this presentation in the following way. I will just give you an introduction on how the whole subject was put together, and then the principles which we follow in our setting, more especially when it comes to buying or supply chain management. And then the problem which from our setting shows how things are in terms of the background of the whole health system and what they wish has to be done. And then to look at the quality cost and then the wastage, which in our setting, you find that they are so rife. And then I will also give some of the example of what we are encountering in our, or we encountered some few years ago, and then the importance of management system within our labs, because some of the labs which we see, you find that there are a lot of things which are left to be desired. And then the continual improvement methods or approach which we can utilize. And thereafter, it will be question and answer. So colleagues, from where I am sitting, I try to look at some of the presentations or articles which I went through, because this subject is closer to my heart when it comes to wastage in the health system. I also look at the health ministry in our side of the earth, or in South Africa, when it relates to quality, that the biggest challenge in the lab from the health system, which they have observed, they realize that 25 to 30% of the errors which are made, they do affect, or they translate to a bigger problem within the health system, which also affect their budget and contribution. So when you look at from some of the articles, which I know the latest one, which I even contributed, is that if you look at the pre-analytic challenges, which include these tubes in particular, which we are talking about, it is not less than 65% of the diagnostic error which happen within our setting. And when you look at it, almost 90% of all cancellations within our labs, you realize that it's a waste in a nutshell, because consumables has been used, and the patient specimen has been used. The time has also been consumed, which the staff have to be paid. And those errors as well, if you look at it, it constitutes a lot of challenge to our costs, which we incur within the labs. So the question which we have to look at is whether do we note this and then take some holistic approach to deal with. So here, when you look at how we supply tubes, our setting in simplest term, we have a central supply chain system whereby they will look at demands, and then which we look for what is required for our labs, and then it will be acquired, and then from logistical point of view, it will be sent to the labs, and then after which what was expected, it was after we use it is a normal waste, and then that's it. So they will look at the demand. However, when you look at this demand, the way it is assessed, they look at the needs to ensure that everything which we acquire is precisely what we are looking for. And then they will link that to the budget, and then the labs have to submit their plan, which it has to do with their annual which in fact is their annual budget. So you could see how the demand and the budget comes together. So here you look even in the part of this acquisition. When you buy, you realize that you have to look at the market value. You go wherever which you think it would be fit for you to say this supplier has got what we are looking for. However, all the suppliers, colleagues, I have to tell you, in our side we scrutinize all of them, because we don't want things which can't work within our system. So all the suppliers which are on the database, that is what we look for. So the documentation has to be done, and then they complete the evaluation of saying this supplier with what they are providing, it stood the test of time, and of which then if we need to go on tender, if it's a bigger project or a demand, we will look at that as well to say, for this one, because we need a lot, we have to go for a tender. So the logistical part as well, the way it is set, we have inventory which we have to have in our disposal, and then we review the vendor performance as such on regular basis. The vendor, it will be looked at the time they send things to us, the quality of their products, as well as the cost as well, to say, is it fitting what we are looking for? And then anything which it doesn't work, we will put it as our disposal, or after we use that, we dispose the items. So the supply chain on its own, it has got its own norms and a standard of some sort. So there has to be compliance. So the main aim is that everything has to be value for the money, because this is cost effective. So from here, you can see how strict we become when it comes to the purchasing of our consumables. However, the tricks now comes when it has to be used, because in simplest term, when you look at our system, you realize that there are areas which there is where it has been a challenge for some times. So there are few areas which we know that it is unavoidable, but there are those things which we have to avoid, like the era whereby these consumables, you find that without proper quality system within our setting or medical lab, they will be there. And those are the ones which we thought, let's look at them today. And then the government also look at this part of saying we have lack of resources. The resources on any environment, we know that we don't have the leeway to just splash things, and then you find that the next thing you don't have, and patients are suffering. And then the biggest part is inefficient use of these resources, which the next speaker will be focusing on the effectiveness of those usage of resources as such. So when you look at where we are, these are some of the parameters which we know that they endanger the health system as well as the life of patient, and it costs because it also reduces productivity. So this, the way they are, when I was looking at it, I realized that this is one thing which me and you, we have to look at it holistically and to remind one another for our setting, for our labs to perform optimally. So we have to look at this as a quality cost, because there are three types of quality cost which we have to understand. And the first one, which is preventive, and the other one, which is appraisal, and the other one, which is failure. So when we look at this cost, the total sum of them, it represents the difference between the cost which when you buy the product or the service which you render, and the way we wanted to reduce it, it become a real failure. So somehow it is one of those things which, from our side as lab or medical staff members, we have to be well versed with. So we have to look at the dynamics, because on this pre-analytic, there are a couple of things which were not considered. As much as there are papers which have been looked at as to say, how do we minimize these pre-analytic challenges and put them under control? As much as some, they try to standardize, but to succeed as such, it needs a holistic approach and a reminder on regular basis to say from here where to, because we are getting the problem somehow, but monitoring of it is quite critical. So the area which we realize that these pre-analytic costs are so eminent or are so rife, you realize that on the resampling of some, of this test or the sample which we requested, the retesting itself, the additional time which we have to run. By the way, think about it. When we look at the rejection of our samples within our environment, you realize that in most instances, be it after we have tested or prior to our testing, which is pre-analytic, you look at the consumables which have been used, they have to be thrown away. And because patient wanted a result or wanted to know their fate, to say, what are you telling me as a patient, to say, I'm sick, I brought your specimen, my specimen to you, then what are you saying? So for the mere fact that at first it was not tested, then it means it has to be resampled. The second part, it has to be retested. And then we have to ask maybe the same staff members, or we have to get another staff to redone the test. So you look at that parameters, all those areas, to say, this is a waste. Instead of using one, we are using two. And you look at, even when we are analyzing this, the time for doing this root cause analysis of the errors which have happened in our environment is quite costly. So in essence, I took one of the measure which we have in our setting. And then this measure was to say, let's look at our quality indicators, and we look at our rejection over a period of time. We realize that in a given time, you will find that our rejections, they were quite high. And when we look at this rejection, you realize that in 2021, not 2014, we had a lot of this rejection. And then we compare to the rest of the departments. So you can see the business unit here, as we are saying. It is quite huge. So there are a couple of things which, for this department, this is one of our department which we realized that they couldn't achieve what we put as the rejection because of the same measure where we were looking at, but we are losing a lot of revenue. And the budget of these tubes which we are using here, you can see is roughly ranges from 10%, from 10% to 16%. Which is a lot. This 16%, you have to see how many samples are we rejecting in a given time. This was one department. And then we look at, in essence, how on month-to-month basis, the average of hours of the sample which we were losing as such. It shows that these samples which we are looking at is as per tube. And then you look at the test repertoire as well on another department. There are so many in this instance as well. So you look at their volumes. We are talking about something around 50,000 a month samples which we receive. So when you multiply those percentage to those to the volumes we have here, it is on one department per month. And then we look at the reason of these cancellations, and then even the other department which is here, you can see the difference. So as such, colleagues, one of the things which we have here in our setting is the so-called EGK. EGK is an electronic gatekeeping. What basically, because we are funded by the government, or the government is our main is the custodian, is the main customer to us. What they do, they give us the budget. However, for them to make use or control their budget, they have a system whereby for the lab not to overspend on the pathological test, they have a system whereby if a test has been done in a short period of time, the same test, the second time it will block it. So they've got a criteria whereby they realize that the clinicians or doctor tend to abuse the system. In some instances, it is a doctor's discretion where they think it is proper, but the government will say, no, this one, let's first deal with the first part. So that is one main driver. And then there are some which we look at which are like the cancellation, where someone will phone or say, we don't longer want that test. And then the incorrect tubes as such, you look at the unsuitability of sample on a particular department. This is in a given time, in a month. You find that 264 samples. I'm talking of some scenario where you find that this sample is the whole month sample. So in our setting, it is it's one of those which we are just throwing away. So it's a loss on that one. So we looked at the volume on this particular one, more especially of our chemistry department. The volume there we are talking about for the test is almost 250,000 a month, which is a lot as well. So when you multiply those proportion with what we have been having, you can see there is a big significance of rejection on our side. So these are some of the way these consumables are thrown away. When part of what I do, I will have to go to either stores or different department just to see those expired ones. So if you look at each and every tube there, it has a monetary value. So those things at times, those tubes which we are seeing here, they have to be thrown away. So that was the tendency which we encountered in our center until we realized that we have to do something here because it's a waste. It can't be used. So if you look at what I was showing here on the issue of expired reagent, tubes, you can see there are a number of them. So these things need to be addressed on all aspects of our testing phases. So we look at this and then we realize that it has to be maybe checked. So I look at the test tube each in different setting. So from what we had, I look at the value of these tubes, and then I realized like some they cost around 50 US cents to $1.4 per tube. So you multiply those number of what we have lost, and then you realize that it's quite important that we have to have a system indeed which can interrogate this. I mean, I look even on the new standard which we have in our medical setting, which if you look at the resources in section 6 of the new standard, it shows that consumables are part of the system. So meaning that quality-wise, we have to have a system in place to say, how do we go about it? Same applies to the processes, which it is pre-examination on section 7 of the new standard. So part of what we need to look at holistically, colleagues, is to make sure that this standard works for us than another way around. Because if we don't evaluate, like the usage of those quality indicators, it helps us a lot, the measure which we have to say on monthly basis, where we have this dashboard. How could we improve? So we realize that there has to be an approach where on regular basis, we visit this with a very holistic approach. So there was this Kaizen approach, which as much as it was meant for the manufacturing, we realized that it is quite important for us to look at it on regular basis. So part of it, this case, and for the sake of those who doesn't know, because that was the intervention which we have to implement. It is one of those approach whereby you create a continuous mentality on the basis of saying whatever which is small, it can improve. In fact, what we have look at the changes, regardless of how small it is, you can have a very good, significant improvement out of it. Because you look at the people whom we deal with on regular basis, it becomes a challenge. Sometimes you find that they will be blaming someone to say it's not us and all those stuff. But with this challenge, we realize that maybe the philosophy on this principle, it can work for us. Some of these tests which can be avoided is whereby you find that the usage of an expired tube, people just think things won't, it won't have any impact. And when we look at this case and approach, we realize that for staff, they have to be conscientized that don't work on assumption. use facts. And the other part which we realized it was that you have to be proactive on whatever problem which we are faced with. Hence, on our setting, we look at those quality indicators. And then we mustn't accept the status quo, because in most instances, we will say it is it's normal, as if it is supposed to go like that. So we don't have to accept the status quo per se. We have to know what we are supposed to be doing, because it affects our budgets and our testing approach, even the service delivery, and it also gives the patient challenges as such, or it hurts, so to say. So we have to look for solution than to get mistakes per se. Whenever we find this mistake, let there be a solution. So what we looked at as such, because for the mere fact that we wanted to categorize, if you look at this, what we have here, we wanted to look at the main drivers of our setting to say, what is it? And then when we plot all of these, we realize that it helps us to go to the bottom of it. Because in most instances, this is what have been the challenge, whereby people just accept things as the status quo. We also encourage environment where everyone has to participate. But with the challenge which we were having, we realized that we have to have a sort of a specific approach, whereby, number one, action has to be taken on the spot for us to reduce these challenges. More especially because we look at the amount of money. Think about it, colleagues. We are saying some is around $1 per tube. And just think about it, if you are losing almost more than 1,000 in a month, how much are you losing in a year for a particular department? I'm talking of an institution with about 7 departments. So if we are losing those in a given time, I checked for example, in our chemistry testing repertoire, for which the tests there are almost 250,000 a month. You can see that that is a big area. And if we are throwing tests which were supposed to generate funds for us, which is, when I look at 2.5 or 3.1% or 3% of those, you realize that it's almost 7,500 per month. And then you multiply by the tubes which we have there. It is a significant loss as such. So those are the things which I wanted us to look at. Hence, we engage, we end up being on this outreach program, which we deal with our clients. We visit the clinics and the hospital. And then where we also look at how this get improved is where we have the laboratory phlebotomist who knows what are we looking for when it comes to the tubes and the sample type. Unfortunately, because of the other resources, which for you to have a lot, it becomes a problem. But where these laboratory flaps are available, we do work, we reduce this rejection of pre-analytic wastage. And then we also look at the trend on regular basis, of which the very same way which I was showing you to say, when we look at the main drivers, we knew exactly where we have to go and what we need to look at. And then as such, the biggest thing is to correct the root cause as such. So colleagues, I would like to thank the team, and then I will wait for the questions. And then as such, I'm really much thankful. I thank you.
Thank you very much, Chakando, for such insightful presentation. So many times we take it for granted when we have expired tubes and when we receive a sample that is in a wrong tube. that there is a cost to it, a cost in terms of the purchasing of the tube, a cost in terms of the personnel who collected the tube, in terms of the time that they used, and the delivery of the tube to the lab, and even the cost in terms of rebleeds, and even the cost in terms of the time to diagnosis that will occur in terms of the delay in the time to diagnosis. And thank you for enlightening the important part that the lab can play in terms of phlebotomy or training of those who are involved in terms of sample collection, in order that we ensure that we minimize the losses that we incur. I would want you to unshare your slides so that you will have questions at the end and the discussion, so that Dr. Aaron Maramba will be able to share his slides. Dr. Aaron Maramba, please share your slides. If you have any questions or contributions, you are free to type in the chat forum. At the end of the discussion, at the presentation, we will have a time for discussion and question and answer during the roundtable discussion. So you are free to also share the question via the chat box, or be able to speak to your question. Dr. Aaron Maramba, whilst he's sharing his slide, is going to be sharing on the efficient management of lab supplies. He is a medical laboratory sciences program coordinator and a senior lecturer in the Department of Laboratory Diagnostic and Investigative Sciences at the Faculty of Medicine and Health Sciences at the University of Zimbabwe. He is going to present on the efficient management of lab supplies. Over to you, Dr. Aaron Maramba.
Good morning. Thank you, Dr. Redzo, and good morning to everyone, wherever you are. Today, I'm going to talk about the efficient management of laboratory supplies. So this topic, or this area, is so much connected to the presentation that was given by Chaka. To Chaka, thank you very much for that brilliant presentation. I think you preempted a lot of what I was going to talk about, but all the same, there are some few additions to what you have already presented. So on my presentation, which is the efficient management of laboratory supplies, I've broken it down to look at organization of laboratory services. I'm going to speak to laboratory services that are provided in different settings. We've got laboratories that are connected to hospitals. We've got national laboratories. We've got private laboratories. I'll also talk about laboratory service commodities. These are the commodities that we are talking about today, and trying to achieve efficiency in that. There's standardization which is required for efficient operationalization of our laboratories, but also for us to keep to maintain our services accredited where the accreditation may be required. I will talk about supply chains for laboratory commodities, which, the commodities are the ones that we need to exercise efficiency. I'll talk about management and policies and the supply chain implications. What is the implication of the management system or the policies that may be in place, or the regulatory frameworks in different countries? I do not know what happens in many countries, but I'll try to generalize so that we can learn, or we can share different approaches from different countries. So organization and operationalization of laboratory services, like I said, lab services settings, they vary. We've got those that are hospital linked and others that are standalone. Most of the standalone labs tend to be privately owned, or could be research kind of laboratories. But within the lab services, these are usually divided into central, national level laboratories and also peripheral laboratories. There are policies which must be in place, and these help to set standards for laboratory practice. And standards that we are talking about is on the tests and techniques. And the tests and techniques will ultimately dictate the commodities that are required. So when you set out your policies, looking at the tests and techniques that are in place, it will dictate the commodities that will be required in your setting. So a well-organized supply chain obviously will enhance availability of commodities that are required, because that's the basis, or that's the foundation of an efficient system. We know that there are unique characteristics of laboratory commodities, and that uniqueness impacts on the way the supply chain should be designed. So that way, we can't say one size fits all. So you look at your characteristics of the laboratory commodities that you need so that you work them out. We know that in most countries, these commodities are imported, and we have got a lot of lessons that we learned during the COVID era, and the impact that COVID had on the whole world with regards to the commodity supply. So laboratory services commodities, this depends on the levels of logistics. This depends on the levels of the logistics. So depending on the levels of logistics systems that are in place, and also the size of your organization, laboratory services, we can take up to 3,000 different commodities that are required for an organization to function. But obviously, there are smaller entities which may require less, but we have to encompass everybody. Laboratory commodities include powders, liquids, and kits that are already made. And these products should be kept in different environments. We also talk about equipment and spares. They also come in as supplies, which must be managed so that we have got an efficient way of operating. For dry laboratory chemicals and consumables that are coming in liquid, these are often packaged in bulk. So we need to find a way of handling them. And they've got different expiry dates. So expiry dates are very important because they are also responsible for when we would say we've got an efficient system or non-efficient system. So our efficiency is hinged on the expiry dates sometimes. Some laboratory commodities have extremely short shelf lives, which means we have to get fewer numbers on site. Otherwise, they will expire on us. And we also look at the shelf lives as we order these products. For example, some control reagents have got a shelf life that are 3 months or less. And in most cases for these controls, they will be imported. Some of them for us in Africa, they will be coming from, say, America, and the shipment period may be long to an extent that by the time they reach the destination where we are, they will be expired. So that brings a point of insufficiency. For us to achieve all that, we need to think about standardization. And the standardization is a prerequisite for strengthening laboratory logistics, really. And this standardization is a process that is required to establish the test menus. Because once you know your test menus and techniques that you are using, as well as your standard operating procedures, this will help in every level of the system that you are operating at. It is also important to standardize tests and techniques and instrumentation because standard testing protocols are very important because you can set it out so that they complement the existing treatment guidelines at your setting, all in the way of trying to manage your commodities. However, there are challenges to standardization because remember, I'm speaking to a wide range of laboratory settings. We've got massive labs like where Chaka works. We've got smaller labs that we also should not forget. These are smaller labs that give services in smaller communities. So we also need to think about them. And a number of challenges are inherent in the standardization process, obviously, because of what I've just said. They are in different sizes, and we don't have to have one size fit all. So those challenges will include technologies for key laboratories, which are routinely changing, because we've got a life of equipment that is in use, and even suppliers of kits, they always evolve and change. So when you've got this change in programs, our standardization also needs to be kept abreast with the changes that are happening. It is also difficult to agree on equipment, even in a coordinated or centralized places. In most countries, the government-owned institutions tend to buy equipment that is similar. That's fair enough. But in terms of standalone labs and smaller operating entities, we cannot always come to an agreement as to which equipment to use, because standardization would work in trying to achieve similar results, or because our patients that we serve, they move across different labs. So that's why we require that standardization. But obviously, the challenge would be on the changing technologies that we may have in institutions. The tests and techniques agreed on in a standardized system may not be consistent with the test techniques, because remember, there are staff who are involved in this. There are labs with SOPs, accreditation. So those changes that will happen, or training that is given to staff, must be done consistently or regularly to be able to keep up with it. But it becomes a challenge, because the challenge may come in the form of cost. The challenge may also come in the form of managing the staff who are able to run on these standardized procedures. There may be procurement laws, especially if we are operating from the government settings or bigger entities. The procurement laws which are in the country will forbid certain things from being done. If, for example, you cannot put out a tender by specifying a specific brand, you can't do that. Although you know that you've got your preference, you can't do that. So we have to work within the procurement laws. And to some extent, it becomes a challenge in trying to standardize things. Also, implementing standardization, it is necessary to set in place a policy that allows lab equipment to be exception in some practices. So yes, there are procurement laws or there are standards that are there. Sometimes you may be found bending those so that we accommodate. Which takes us to the supply chain and the product selection. So product selection is very important. Remember, always, we've just talked about standardization. So once you have standardized, you need to think about product that you are going to select. So selection of a product that are appropriate is based on the testing protocols. Remember, we talked about looking at the test protocols, and also you think about the cost size. The size of the institution will determine the cost that you can afford. So we look at testing protocols, we look at the cost, we look at the training of personnel, we look at the infrastructure, and also the storage and transportation facilities when we select the product. Where is the product coming from? Is it coming from somewhere near? For myself here in Zimbabwe, we've got local distributing centers or local suppliers, but there are some products that we don't always find in the country. We may get them from neighboring countries, from South Africa. We may also get them from overseas, from China, from Europe. So all those things come in. There are drawbacks and benefits, obviously, when you look at that. When you buy a piece of equipment which has got a closed system, closed systems are good for the manufacturers, but they are sometimes not so good for the users, because if you are using a closed system, it means you only have to use a particular product. And when that product cannot be guaranteed supply, then you may face challenges. However, the open systems allow economies of scales in the procurement of products. But it must be a win-win situation whereby the consumer, myself on the lab side, is fighting to make sure that there is efficient utilization of the products. On the other side, there's a supplier who wants to push their product. So that must be balanced there. The open systems do not benefit or favor manufacturers because if it's an open system, it means any other product, a manufacturer of a consumable can have their reagent placed on one's equipment, which means the manufacturer of the equipment may suffer by making the equipment, but your reagents may not be used because it's an open system. So that's why we're talking about the closed and open systems there. Therefore, laboratory must be prepared for changes in the technology. So there are many technologies in the developing world where we are. We prefer open systems. In developed countries, the closed systems are better. Obviously, closed systems are better in that they sort of guarantee quality and standards that are maybe required in the lab. So if you've got the money, it's easier to work with a closed system. In terms of the supply chain, we need to quantify and our products when we look at our procurement system. Multiple types of forecasting technology methodologies are used, where you look at demographics and also the service data that is there, which can be used to predict requirements for lab supplies. Because remember, you don't want anything to expire on you. So if test numbers are used for purposes of forecasting, they should include qualification of all products that are required. You need to factor in the quality control materials. You also need to factor in materials that can be used for training and other losses, as we found from the previous speaker. So those are some of the things that we need to take into consideration. Otherwise, you buy less, then you run out before the next delivery, or you buy too much, then they expire on you. So it's a balance again. Procurement procedures and arrangement should be flexible. In some institutions, I think a more organized setting is you have a service level agreement with the supplier, where you know that a certain number of products or consumables will be coming at a particular date. But this is predicated on the statistics that you have, where I've talked about forecasting. You can forecast depending on the number of tests that you do daily or weekly or monthly. Then you know that the next supply can come, I will be running low on the stocks. So all items that are required to complete a testing protocol should be quantified, so that the shipment schedules are coordinated, which then guarantees availability of the product all the time. The logistics management information system is required if you can afford it. I think if we're looking at good quality laboratory operations, we need to have logistics management system. But again, remember, we are talking to operators who may be running smaller scale labs where they can't afford logistics management system because these systems can be bought. So you need to consider two ways of capturing consumption data for a lab commodities. Number one is issues of stock as a proxy of consumption data, and also the actual consumption of the products. Those are the things that we can use. You also need to review each product and how it is used or how it is issued, so that you can appropriately manage your stocks as you look at the reports that come along. The use and maintain stock keeping cards. Almost all labs or almost all entities, small, big, or massive, we must have a way of record keeping or stock keeping cards so that we don't run out. It's either you run out, then you pretend that you're, but that's not efficient, because if you run out, you're not efficiently running. If you overstock and the products expire on you, again, that's not efficiency. Today, we're talking about efficiency, so it needs to be a balance. So you need to consider the pros and cons of having one or multiple stock cards for each of the different products so that you never run out. Logistic management information, again, looks at routine report stock issues, which can be implemented in a lab, and so that there are no losses. And if there's oversupply, then you can make adjustments. If you run out, again, you make adjustments so that you always have something in stock. You can use computerization, computer systems, which I said bigger entities, because as humans, I think once we start dealing with large stocks, computer systems will be better. So computerize the logistics management information system where possible, particularly in big entities or the government hospitals that we associated, government labs that are associated with massive labs. So where the stock is running faster, so you need a computer system to deal with that. You also need to develop logistics reports that are easy to complete, and they must be concise so that they are flexible enough for you to use. There's inventory management also. This runs with this supply chain, and there are implications to that, obviously. You need to ensure that the length of the pipeline. So I've mentioned earlier that there are some products that we get from neighboring countries, some from within borders, others from overseas. So we need to be familiar with the pipeline to accommodate the shelf life of the products. So if a product is going to expire in, for example, here in Zimbabwe, we would say we want a product that has got a shelf life of at least 6 months, if they're not controls, of at least 6 months with us. Suppliers find it difficult sometimes because, again, if products are not made specifically for our consumption, they will have massive stocks. But it's also important as managers of our institutions, we need to look at expiry dates so that stock don't expire along the way or don't expire immediately after lending. If we are using the maximum minimum inventory system, you need to consider the standard of forced ordering versions, where forced ordering versions come in where you have got a service level agreement, which says you need so much stock. I will talk about manufacturers of equipment that are on placement. So if you get equipment on placement, the requirement will be, you will give your equipment on placement, but you must use so much product for us to give you the equipment. So you'll be forced to have that from the service level agreement. But I think there must be some understanding where adjustments can be made. You also need to consider signing different maximum and minimum stock levels, so that when you're looking at slow moving stock, it doesn't expire on us, or fast moving commodities, so that they don't run out. So it's a balancing act. The full supply and non-full supply commodities can be managed concurrently, because you can have both in your lab. If there is a transparent process of ordering and resupply, if staffing is limited, because remember we talked about staffing in training when you talked about standardization. If staffing is limited, you may need to consider instituting a push system for resupply of peripheral levels. I'm talking about institutions that are coordinated. You can push your stocks to other consumers within the same organization. Also link ordering and resupply to reporting. A computer can do this easily, but if it's a small organization, you may have to do this manually. Supply together commodities that need to be used concurrently to complete the testing protocol. And the other issue is storage and distribution. So you develop guidelines for appropriate storage for each level of the system. You also need to maintain the cold chain for lab commodities that require it. So if there's requirement for the cold chain, that must be in place, because it's good for quality control. It's also good for guaranteeing good results from your lab, so that the stock don't become bad or new. If we've got flammable, that must be kept. So here I'm talking about managing the storage of different items within the lab. They require different environments. Some stock can be kept in the fridge, some in the storeroom, others in the film, under lock and key. Others are susceptible to fire. So we need to have fire extinguishing mechanisms available. You also need to think about products that are corrosive. So store corrosive materials at normal room temperature, at ground level, and in the original manufacturer's containers. And keep laboratory commodities in the original packaging, because once you start moving them, I know some places where the reagents are left with the dead volume. Those dead volumes should not be pulled. If they need to be pulled, they may need to be quality controlled, but a good laboratory practice requires that those should not be pulled. You also need to maintain commodities under the appropriate storage conditions as prescribed by the manufacturer. So the supply chain operates within a policy environment with certain laboratory management practices that have supply chain implications. And some of the recommendations include the quality assurance and quality control, staffing and management, then policy regulatory environment, as well as financing and laboratory commodities of in logistics systems. So when we talk about quality assurance, this must include procedures for managing commodities in the quality assurance program. You need to define and enforce procedures and policies for the internal and external retesting of the quality. So products that come in my lab, we've got what we call the pre-acceptance. And pre-acceptance is also incorporated in the quality management system. And if you are accredited, you know that you receive a product, it must be tested to see that it's fit for purpose. So that's the internal system that we have. You also need to establish procedures for routine visual inspection. Products that are kept in there, they may not be expired, but they also need to be monitored, because the environment in which you are keeping them may not be suitable. But even if it's suitable, still we need to keep on looking at them visually. So establishment of procedures for handling of suspect or damaged or expired commodities must be in place for a good lab. Then when it comes to staffing and the management, we need to provide training in logistical management so that everyone within the organization is aware or familiar with the procedures in place. You also need to develop a scheme for routine supervision to support the laboratory staff personnel. We know that in bigger organizations, there are more people, different people. So to standardize or benchmark this, the staff need to be trained so that we sing from the same hymn. Then there are policy and regulatory environments in different jurisdictions. So you need to work with national level personnel to develop and encourage policymakers to approve testing guidelines. You also need to work with national level personnel and policymakers to ensure that guidelines and policies for infection prevention and universal safety precautions are put in place. And this includes guidelines and policies for waste disposal, because that's very important to our environment. When you look at, in Zimbabwe, we've got an organization that we call EMA, Environmental Management Authority. They superintend and they can penalize. I think these exist in many countries as regulatory systems. Then when we look at financing of laboratory commodities and logistics system, we need to establish laboratory commodity committee. That's for bigger organization. For smaller organization, this can be managed sort of easily, because the number of tests that we are doing are far smaller and the stock that we are managing is smaller. So there's probably no need for a committee, but for bigger and many institutions, we need to have a committee that works on this. So in addition to that committee, the committee could periodically monitor and review the standards. Remember, we talked about standardization earlier on. So the standards must be looked at, and these are done to establish the standardization, basically. So we work with the policymakers to establish a specific budget for laboratory commodities. Remember, we're talking about financing. Sometimes the reason why we run out is because we do not have funds available to procure, unless you've got arrangements or credit arrangements with suppliers. But again, financial arrangements must be in place. So this is better done through a coordinated system. So when you talk about logistics, basically there is a cycle. So this summarizes what I was talking about, where we look at service customers, we look at product selection, we look at forecasting of the product, forecasting and procurement, and also managing that inventory. And it's a cycle. And this is what we call the logistics cycle, this logistic information where there's money and people involved. And that brings me to the end of my presentation. Thank you everyone for listening.
Thank you very much, Dr. Maramba, for that insightful presentation, reminding us of the importance of realizing the complexity of laboratory processes resulting in many commodities that we have to manage, and the need to ensure that we manage the commodities well, to check them, and also the use of a software to help us manage the inventory, and also the need to ensure that we take into account the budget implications, so that we are in tune with those who control over the budget, instead of us just going back to say we don't have supplies, but we also need to manage our supplies well, and be able to forecast and be able to communicate well. Most questions that were coming on the chat box were based on the need for the presentation and the recording. The recording will be available on the Empower School of Health website, and it will be available after the webinar. And the slides will ask the presenters to share with us after the presentation the email addresses that you use for sending in or for registering will be used to send the slides and also the link to the recording. We would want now to open to some questions and comments following these two related topics. One, which was dwelling on the pre-analytical consumable wastage on specimen collection tubes, quality and cost, which was given by Chakando, and the last one, which was on efficient management of laboratory supplies, which was given by Dr. Aaron Maramba. We now open to the questions and even contributions to this presentation. Yes, I see Venus Mushininga, who has their hand raised. Can you unmute so that we can hear your question? Unmute. Yeah. Please unmute your mic so that we can hear your question. Venus, try to unmute now. We have given you the right to unmute.
All right. Thank you so much for the presentations. I just want to find out from the last speaker. They spoke about that they indicated that closed systems are preferred in low resource settings versus open systems because of issues of quality control. I wanted to find out if having closed systems doesn't disadvantage us more, because then I think it limits our access to reagents and consumables. Then we end up having higher costs from manufacturers. And I think there's a challenge where maybe this, if you've got a closed system, I think especially during COVID, you realize that it was a challenge, because if someone is monopolizing the market for that closed system, all the closed systems we have, we are stuck. So I wanted to find out if there are any other factors that were considered in coming up with that inference, because I think open systems, we should strengthen our quality issues, then advocate more for open systems. Thank you.
Thank you very much, Venus Mushininga. Dr. Maramba, you can respond to that question that was directed to you.
Thank you, Venus. I think it may have been a mix-up in what you heard or what I probably said. What I was referring to, the closed systems are not, well, the open systems are preferred in the low resource countries, like the African countries, because of what you exactly said. With regards to quality, obviously, there are challenges with standardization of open systems, because remember, you have got various permutations. You've got equipment that is coming from different manufacturers, and you've got reagents that are coming from a different manufacturer. The challenge that I can talk about is on standardization and guaranteeing quality. But however, in terms of operations, it's more preferable in low income countries to have open systems. I don't know whether that answers your question. Everything that you said, I agree with. The only challenge is on making sure that we guarantee quality and being able to standardize reagents from different suppliers on a single platform. I'm talking about automated systems as opposed to the manual methods.
Thank you very much, Dr. Maramba, for that. I just want to check if Chaka would want to add, or Bettina on that. Because each system has its own advantages and its disadvantages, and we just have to note these and make the best choices based on what our knowledge of the advantages of the disadvantages of the open or the closed system. And the open is widely used in this part of the continent in Africa, because you can get reagents which are easily available from any manufacturer, though the challenge of counterfeit reagents is also a big challenge. Bettina, yes, you can also comment before we go to the next question.
Yes, thanks. Can you hear me?
Yes, we can hear you.
Okay.
Thanks, Dr.
Yeah, before I comment on this, I just want to really commend the two speakers, Chaka and Aaron. These were excellent presentations. And, Chaka is actually my colleague, but I must tell you that I've listened to him many times. Like each time I listen to him, it's like I'm hearing him for the first time. And I just want to comment on the issue regarding the closed and the open. Look, in academics, we like a closed system for the obvious reason that quality is almost ensured. But we sit with a big problem. You will run around trying to find your supplier to actually give you reagents. Like as I'm talking to you now, we don't have reagents for conjugated belly. So we have to fight with the supplier today to make sure that we get those reagents. So this becomes a problem. Now, what I've also noticed is that probably a semi-closed, whereby the supplier will say, we have this list of trusted suppliers, so-called trusted supplier, whereby the list is not so open. So kind of they give you an indication of which reagents they have not, based on the history, had any problems with. Because the truth is, when they provide you with this information, you are kind of going in there to purchase the reagents with some kind of assurance that you will be able to get the results you want. Because there's nothing as frustrating as not being able to give your clients your answers. As I was listening to the presentations, I received a WhatsApp message from one of our clinicians complaining about a low A1C result. Now, when you have an open system, your most common query will be, can I really trust these results? When they are complaining, you would find it hard to believe that these controls can actually be trusted. These reagents can actually be trusted. So indeed, open system is preferred for the small labs, but for a tertiary lab, it's very difficult to work on an open system. It is very, very hard. But as I already indicated, it's both sides have a big problem. Semi would probably be an ideal. I hope this answers your query that you raised earlier. Thanks so much for the opportunity.
Thanks very much, Dr. Chalematau. It's a challenge which we have to boggle with, but we just have to make a decision based on our knowledge of the advantages and disadvantages, and also a good way was shared. The way you can also hear the trusted suppliers of, apart from the manufacturer, in case when the manufacturer has run out of the reagents, because most manufacturers are based out of Africa, which is the challenge which we face. And hopefully in the near future, we'll have more and more products being produced in Africa, which we can also be able to trust, and which will enable us to manage the supply chain well. The next question or input would be from Tamarit Alemu. Can you unmute your mic so that we can hear your question? Whilst Tamarit is unmuting their mic, I just want to indicate to you that the presentation,
can you hear me?
A link will be available after this, and also the link to the certificate will be available. You get it on email. Yes, Tamarit, can you?
Yeah. Shall I continue?
Yes, please go ahead.
Thank you, Dr. Aaron, for nice presentation, especially with peculiar characteristics of the laboratory commodity supply chain, like technology clock speed, and other short shelf life and open closed system. I have two questions. The first question is, would you share your experience in disposing the obsoleted laboratory medical equipment? Because some medical equipment, for example, in our Ethiopian country, there are some obsolete medical lab equipment due to lack of reagent, or due to the technology clock speed. They are obsolete, no more use. Would you give us how to dispose obsolete lab medical equipment? The second question, if I understand from your presentation, I say that the closed system, it only favors the manufacturer of that lab equipment. How the closed system laboratory reagents are more preferred than the open system? Because it must be standardized or optimized. We have to, I just recommend to use the open system, because it may be used in place where, for example, in stock out of some closed systems. I didn't get your idea, the reason for just preferring the closed system reagents than the open system. Thank you. These are my questions.
Okay. Thank you very much, Tamar. The disposal of equipment is quite a big challenge, and sometimes most of the times what happens is the suppliers do get the equipment and reuse some of the parts. That's one of the way, and the other way would be is to dispose, where you dispose your medical specific equipment, so that it doesn't go to the ordinary waste, where we get all the hazardous all the other waste from the household waste. That's the other issue. But it's a big challenge you find in most African labs. Lots of unused equipment that is there. And on closed system, the reason why colleagues are indicating that a closed system is preferable is because a closed system, you can control, you have control of what is what the reagents that you are using. They are coming from the producer of the equipment, and there is usually it's associated with high quality. But no wonder why Dr. Matsao even suggested that some manufacturers would indicate if their system is open, preferred reagents to be used whose quality is acceptable on their analyzers. Chaka is also raising his hand. He can also contribute, and if other panelists can also add on, that would be welcome. Chaka, you can unmute your mic and contribute. Thank you.
Okay, thanks, colleagues. I will try to address both of these questions. The first one, in our setting, we have got a company which is called Dexco in South Africa. Dexco is D for David, E for Eve, S for sugar, C for company, and O for over. They specialize on e-waste because here things are regulated. So they are strict when it comes to those. As much as we understand it's a very big challenge on most of even the government themselves, they are struggling with this medical waste. So that is first part. The second part, I wanted us to look at this the closed system and the open system for the reason that maybe to share with the colleagues why we chose the closed system. We, as an organization, because ours, we have got almost 270 laboratories which we have to cater. So the only way for us to get these labs to be standardized when it comes to things was to choose something which is common around our around us, so to say, be it the supplier. So here is how they approach it. They even have a sort of a division within the organization, which they call it HTA, which stands for Health Technology Assessment. So what they were trying to do or to achieve was to make sure that our labs mustn't be a dumping site where everyone just bring whatever which they have and they say it's okay as a supplier. And at times we found on those situations prior to when they introduced this HTA, which it has its own challenges, by the way, because like Dr. Matsao said, you find that there might be this bottleneck of saying reagent, we don't get them as we wish or we wanted as a lab. However, I will explain why it came to that part as well in certain scenario. So when it comes to the open system, if you are a supplier, the organization will say, no, you can bring your supplier so that we can test, so that lab number 2, it mustn't suffer the same mistake which maybe lab number 1 was going to be a victim. So the supplier will be asked, if you are willing to sell to us on your own expense as a supplier, you will have to pay the person who will test your reagents or your equipment. We validate your equipment or verify on site, but at the cost of the supplier. And if it passes, and we realize like it's working, then it will get to the system. So now here is an analyzer which comes to us from the supplier on the closed system. They have to have a legal ground to say, do you have a capacity to provide this? And if you don't, allow third-party reagents or consumables, because if you don't, you must know that you are not, we are trying to avoid monopolization of the system. And that is where most of these suppliers, because they come from Europe, you find that at times it becomes a struggle. And hence, the main aim of that closed system, it protects The lab, however, it has got its own advantage if this big player who monopolize, which is another learning curve for the small labs as well, and all other labs who want not to be victim, because you can't allow where they dump everything on your side. So that is how those closed system and open system were checked. We used to have an open system, but we realized that there are a lot of challenges with open system because most of the guys, they are getting away with murder. They give you something, it doesn't work, it is your baby, they run away. And then that is how they wanted to tie people on the closed system. Quality-wise, we know it has been verified, and then you are part of the understanding of where it is. But where there is limitation, there is where the challenge is. That's my contribution, Dr. Mchangura.
Thank you very much. Any other discussant wants to add? All right. We have reached the end. I would want some parting shots from the presenters and the discussants, and we'll start with Dr. Maramba. If you can give us any parting shots, then we'll come to Chaka and for his parting shots, and Bettina, then we'll have a closing remarks. Dr. Maramba, any parting shots?
Oh, thank you, Dr. Machingora. I would like to thank everyone for tuning in. At the peak, I saw 140 connected audience, which is a very good turnout. What we have learned through this is there are common issues around the supplies and logistics in the African context. I think majority of our audience were in the African continent. It is important that we all appreciate the importance of quality. It's also important again to appreciate the importance of being economical with the resources that we have. Most African countries are low resource countries or low income countries, but we all striving to provide service that is comparable to the ones that obtains in developed countries. So it's important for us to embrace the points that we brought up today. I think I learned from my co-presenter, Chaka. I suppose from what I presented, there are a few texts which people could take with them so that we improve quality in our lab systems and also improve on efficiency. Thank you very much.
Thank you very much, Dr. Aaron Maramba. Chaka, no, any parting shots?
Thanks very much, colleagues and all the participants, Dr. Maramba, you, Dr. Machingura, Dr. Mazao, and Sonia on the other side, and Prof. Erasmus. I feel so humbled at all times when we share our experience and presenting to all of us. Regardless of our backgrounds and where we are, we can achieve what it might seem impossible with this knowledge sharing idea or approach. So I'm very much thankful for participating. I learn a lot at all times, even from the audience. Always I tell people that whenever a question is asked on what I've presented, it validates what I've presented. So that's why always I really appreciate that. For me to have what I know and it stuck with me until it is validated, it might mean nothing. So thanks very much, colleagues. Thanks you.
Thank you very much, Chaka. No, Bettina, Dr. Bettina Chalematsa.
Thank you very much for the opportunity. Yeah, I also just want to say I really appreciate this platform a lot. And I think I see the same thing each time we meet because we really continue to learn from each other. And as I was preparing to get to say something, I noticed Emmanuel Esemokai, I hope I'm saying your name right. I really like your comment a lot, because I think as Africans on this continent, we have learned a lot from COVID. And at this point in time, we need to try to figure out how to be able to utilize our resources to actually be a step ahead, because the truth is the next pandemic is not very far. So thank you very much, everyone. And thanks, Aaron and Dr. Matt Maramba. Aaron, how will I say your name again? Maramba, yes. So thank you, everyone, for this opportunity. I appreciate your time indeed. And I'm looking forward to seeing all of you in the next meeting. Thanks, bye.
Thank you very much, colleagues. I know there are many questions that we could have asked, but we like to keep the webinars short so that we allow to learn as much as possible and be able to learn from one another in as short amount of time as possible. I would want to thank the presenters, Chakando, Dr. Aaron Maramba, for taking their time to prepare and share with us, and even the panelists joining us, Dr. Chale Matsau and Dr. Prof. Erasmus in absentia, for their input even in all this. And I would also want to thank the members of the African Consortium on Laboratory System Strengthening, which is the University of Zimbabwe Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology, African Federation of Clinical Chemistry and Laboratory Medicine, and Empower School of Health. We couldn't have done all this without our technical support from Empower School of Health, who sent us the reminders, who help us with the preparation of the promotional material, who help us with all the work behind the scenes. I'm really grateful for their support. Sonia and the team, we are really grateful for your support. It helps us to share the information that we have and learn from one another. And lastly, I would want to let you know that on the 1st of November, 2023, we will have another webinar on laboratory management best practices. Please look out for that, that advert for that webinar and attend so that we may be able to learn from one another. And slides and the recording will be shared on your emails. Look out for that. And also you get the recording. We do record this to enable you to go listen even after you have learned this, so that you can learn from one another and you are able to maximize what you have learned. And you can also use this as a training resource in the lab. And also you get a link to get the certificate of attendance on your email. Please get the certificate of attendance for use for your CPD points. Otherwise, thank you. Let's have a good day. Thank you very much.
Thank you.
Thank you.
Thank you.
Yeah.